Shall we start the class? Hello? Can you hear me? Anyone?
Yes, sir.
Okay, let's start the class, then join later. Many people have to join yet. Can you see the slide? Hello?
Yes, sir.
Okay. So let's start the class. So last time we have started to discuss about the pathology of urinary system, right? And now today, I'm taking up about the inflammation of these kidneys, what called nephritis. If you're also this nephritis, inflammation of the kidneys, right? And it can be classified into three types. Those are suppurative nephritis, non-suppurative nephritis, and specific nephritis. So this suppurative nephritis can be again classified into two types. Those are pyemic or embolic nephritis. So this type, pyemic or this embolic, this nephritis is of focal type. That means a very few this focus, very this small spot of this kidneys can be affected, where it means you may have this abscess formation and all. Pyemic means where pus exudation will be there, right? And mostly due to embolus, this some emboli. If emboli is there in those vessels supplying to that very particular part of the kidney, if it is there, then because of that, sometimes of course some organisms, some infectious agents like pathogenic organisms getting into the system, when they are going through the blood circulation and reaching to the kidneys, and particularly those these vessels supplying to that very particular point of the kidney is having emboli. Okay, this, and in that case abscess formation used to be there. And this very particular this type is, that's why it is of hematogenous type. That means the etiological agent, the organisms like particularly these pathogenic organisms, and they used to gain through the circulation, blood circulation, and reaching to the kidney, and they used to affect a very this simple this focal focus, very particular point of the this kidney where abscess may be formed, right? Then next type is pyelonephritis. Here almost all the parts like the kidney and the renal pelvis or the renal cortex, both all can be affected, and where of course this pus exudation will be formed. And particularly this kind of this pyelonephritis used to be urinogenic. That means through the urine, means the organisms used to gain entry. That means ascending type. Okay, from the floor, when the animal is lying on the floor, for example, and through the urethra and all these things, and when they are passing urine and all, through that, this organism used to gain entry and climbing up to the kidney and affecting this kidney and causing this suppurative type of this nephritis. So that very particular type, when it affects almost all the parts of the kidney used to be there showing pus exudation. So that is known as pyelonephritis. Then next is non-suppurative nephritis. Here means there is no any suppuration, no formation of this abscess and all these things, right? So non-suppurative. And it can be again classified into three types: interstitial nephritis, tubular nephritis, and glomerulonephritis. So from the name itself means you must be having the idea that the interstitium, that means the tissue in between the tubules. Okay, that those this known as, in case of this kidney, interstitium. When the inflammatory reaction is confined to those parts of the kidney, then it is interstitial type of this nephritis. Then when it is affecting the tubules, particularly the tubules are affected and showing that this inflammatory reaction, then it is known as tubular nephritis. Then when it is affecting the glomeruli, okay, particularly the glomeruli is inflamed, then it is known as glomerulonephritis. Because of that this infection or this inflammatory reaction to the glomeruli, the kidney is inflamed. So that kind is known as glomerulonephritis. And then last type, that is specific nephritis, I'm just giving the example of tuberculosis, one disease caused by this Mycobacterium tuberculosis or Mycobacterium bovis avium, and in case of this avian species and all. So this Mycobacterium, this bacterial organism, used to cause one kind. This they can also cause, this nephritis in case of those, specific disease. So this is specifically for that particular disease. So this kind of this nephritis is known as specific nephritis. Okay. So now I'm just giving some little bit details about the different types. Pyemic or embolic nephritis, as I have already mentioned you, that the organisms used to gain entry through the renal vessels, and they used to cause some particular point of the kidney where some specific pyogenic infections, okay, like Streptococcus, Escherichia coli, Corynebacterium, pyogenes and all. So they used to gain through the blood circulation and affecting particular point of the kidney, causing the formation of this abscesses and where pus exudation used to be there, right? So this kind of this condition is known as a nephritis, is known as pyemic or embolic nephritis. And grossly what the kidneys used to have this involved, where of course some particular points foci, because it is being this focal, okay, not generalized, okay. So those parts, may show these abscesses, and that they are also congested, and some irregular yellow or gray areas may be seen on this under the surface of the renal capsule. Okay, so let me show you some photograph here like this. Some focal, if you see the renal cortex here, this some grayish white and these areas, focally, this they may affect. Okay, and if you make the section, so you may find this separative type of this inflammatory, with particularly of course neutrophils used to be many more, this predominant inflammatory cells, and this separative inflammatory and this reaction will be there in the this kidneys like this. Okay, these are the focal areas where suppurative inflammatory reactions used to be there. Suppuration is there. Liquefactive necrosis. Okay. Then next is pyelonephritis. As I have already mentioned you, that this is mainly this inflammation causing the all parts of the kidney where pus exudation, formation of this, the abscesses is also common, and pus exudation used to be there. Okay, so it may affect the renal pelvis as well as the renal cortex, affecting all and this parenchyma of the kidney, means all parts of the kidney, right? And means here also they may show the presence, this formation of this abscesses, then congestion may be there, suppurative inflammatory reaction, and lastly this fibrosis also may be there in chronic cases. Okay, and mostly caused by pyogenic organisms like Corynebacterium renale, Staphylococcus aureus, E. coli, Actinomyces pyogenes, then Pseudomonas and all. And grossly, if you see the affected kidneys, they are usually congested. Some may show on these hemorrhagic lesions, and mostly abscess formation in the renal cortex, pelvis, as well as the ureters. Okay, and the urine which used to be present there in the this urinary bladder used to be mixed up with the pus. Okay, pus mixed urine will be there in the urinary bladder. So that what we call pyuria, and that will be coming out of the this urinary system through urethra also. And when you check it, you will find that pus is already there in the urine. It is mixed up. Okay, and all the kidneys used to be enlarged, and microscopically, if you make the section, then you will find the renal vessels are congested, some are showing hemorrhages, and the necrotic, these lesions of the collecting ducts may be there, and purulent exudate inside the, your renal pelvis, with infiltration of many inflammatory cells, mostly neutrophils, because in case of this pyogenic bacterial organism and this infection causing this suppurative nephritis, this inflammation, so mostly neutrophils used to be there, right? So along with that, some other these cells like these lymphocytes and plasma cells may also be present in the interstitium. Photograph showing this pyelonephritis. Okay, pus exudation is there in the renal pelvis, and abscess, and it's also, if you see that these abscesses are there on surface, okay, renal cortex. Then if you make the section, also many places this suppurative, this inflammatory reaction, and this are there with infiltration of many inflammatory cells, mostly neutrophils, right? Then coming to non-suppurative, under this non-suppurative inflammation and this nephritis, we have three types: interstitial nephritis, tubular nephritis, right? So first one is about the interstitial nephritis. So as I have already mentioned you that.
Excuse me, sir. Some students are waiting, sir.
Okay. Else, I think. You are disturbing a lot when you are joining it very late, no? I'll not allow anybody else now. So in this case, the interstitium particularly means the interstitium in between the tubules and all that, this very particular part used to be showing the inflammatory reaction, where it can be having, this degenerative and necrotic changes, particularly the tubular epithelium and the outer part, and then edema and infiltration of inflammatory cells, and mostly caused by this ochratoxins, atronine, then toxicities and poisoning cases like pesticides toxicity, then herpes virus infection, endogenous toxemia, ketosis, and as well as in this immune complex formations. Okay, and when you see this affected kidneys, mostly the kidneys used to be very much enlarged and damaged or necrotic changes, and some congestion and hemorrhagic lesions also may be there. And microscopically, if you see this affected kidney after making section and after staining and all, you will find edema, congestion, and hemorrhagic lesions, and the necrotic and the degenerative changes of the tubular epithelium, with infiltration of many inflammatory cells like neutrophils, macrophages, lymphocytes, particularly in the interstitium. That means the tubules, in between the tubules like this. Okay, it's not the tubules are affected. The tubular epithelium may be affected little bit, but in between these, the tubules, this part, what we call this interstitium, so that used to be mainly this showing the inflammatory reaction with infiltration of many inflammatory cells, right? Then this tubular nephritis means here means in the slide this one I have already mentioned that. So in that particular this type of this tubular nephritis, it used to be confined to the tubules. Okay, means the tubules used to be very much disaffected with inflammatory cells and degenerative changes, necrotic changes, and mostly tubules, not in the interstitium, not in the glomeruli. So that's why it is known as tubular nephritis. Means tubules used to be affected, and the inflammatory reaction used to be confined to the tubules only, right? Then the third type is glomerulonephritis, when the inflammation is confined or mostly there in the glomeruli. Okay, and which may, this give this inflammatory reaction, and grossly, if you see that, mostly the affected kidneys are very much pale and enlarged with some this potential hemorrhagic lesions. There may be edema and congestion or infiltration of inflammatory cells there in the glomeruli. And mostly here in this glomeruli, presence of some this mesangial cells used to be there. So because of the presence of this mesangial proliferation, all these mesangial cells are proliferated. Okay, so this type of this glomerulonephritis is known as mesangial-proliferative glomerulonephritis, in short MPGN. Okay, and this kind of this inflammation, where the glomeruli is mostly affected, so can be caused by streptococcal infections, formation of immune complexes, then environmental pollutants such as chlorine, pesticides, and all this, right? And If you see this affected kidneys grossly, they will be much enlarged. It will be edematous and pale in color, and there may be some petechial hemorrhages on the renal cortex. Then the urine which used to be produced from such kind of this affected kidneys, where the glomeruli are mostly affected, so they may be showing the presence of this protein in the urine, what we call proteinuria, then uremia, then hypercholesterolemia, and the increased creatinine level in the blood. There may be this retention of these waste products like creatinine. Okay, so it will be, this retained, and it will this reabsorb, and it will go back to the circulation, leading to high level of these waste products, particularly of this type of this creatinine, right? And microscopically, if you see that this glomeruli mostly, and that very particular part, means it will show the inflammatory reaction with then infiltration of many inflammatory cells, mostly of neutrophils, macrophages, sometimes some few lymphocytes and all. And there may be compression of the blood capillaries with absence of erythrocytes. And sometimes there may be formation of thrombosis and necrotic lesions of the glomerular capillaries. Okay, and basing on the lesions, when I was talking about messenger proliferative glomerulonephritis due to the presence and the proliferation of the messenger cells. So it can be again divided into 5 subtypes. Okay, these are some photographs of the glomerulonephritis and these kidneys, where the glomeruli see. This glomerular, this region, used to be affected with severe disinflammatory cell infiltration and all, right? And 5 subtypes of the glomerulonephritis basing on messenger cell proliferations are type 1 MPGN, type 2 MPGN, which is also known as membranous glomerulonephritis, then type 3 MPGN, also known as acute proliferative glomerulonephritis, then chronic glomerulonephritis, and focal embolic glomerulonephritis. Okay, so these are the 5 subtypes of this glomerulonephritis basing on the messenger cell proliferative changes. Okay, so what we call MPGN, messenger cell proliferative glomerulonephritis, right? And now coming to next topic is about nephrosclerosis. The term sclerosis in the vessels, also in the blood vessels, where I have to discuss about atherosclerosis, arteriosclerosis. Okay, like thickening of the blood vessels walls, right? So leading to hardening of these vessels and all this, right? Similarly, in case of these kidneys, urinary system, when we are talking about particularly of the kidney, when it is showing chronic fibrosis, leading to this very much hard and firm type of this these kidneys. Okay, so that very condition is known as nephrosclerosis, where you may have a loss of this glomeruli, tubules, as well as there will be very much extensive fibrotic changes, fibrosis. Okay, and mostly it may be due to glomerulonephritis, severe type of this glomerulonephritis, interstitial nephritis, and arteriosclerosis, means when those vessels, renal vessels, arteries, they are showing sclerosis, thickening and the hardening of the vessel walls and all. So this may be the reason that the kidney is also showing fibrotic condition or sclerotic condition, right? And if you see the grossly the affected kidneys, so they used to be very much atrophied. Decrease in the size of the kidney, not increase as in case of this acute and this form of this nephritis and all. Here, there used to be atrophied, means reduction in the size and hardening, very much hard and firm. And there may be presence of some fibrous nodules on the renal cortex, on the surface of the kidneys. And the capsule also used to be very much thickened. And there may be some this white form kidneys may also be there because of this, the condition, what we call this nephrosclerosis. Okay, and microscopically, we should see that there may be ischemia, this blood and this vessels, they are sclerosed and thickening and all, so blood supply may not be proper this there may be deprived of this blood circulation this blood supply to some part of the this kidneys. There may be tubular atrophy, loss of granuli and the tubules, as well as extensive fibrous connective tissue proliferation leading to fibrosis. Okay, that's why it means the kidney size used to be reduced, what we call this atrophied. Okay, atrophy, this condition. And there may be, in some cases, deposition of the hyaline mass and mostly in some this mononuclear cell infiltration or presence of this mononuclear cells, particularly of the lymphocytic cells, used to be there, right? So that is about this nephrosclerosis. And the next topic is about urolithasis, formation of stony hard substances. People normally used to talk about this kidney stones, right? So this kind of this stony hard substances, which is formed in the urinary system, maybe in the kidneys, sometimes maybe in the ureters, in the urinary bladder, or maybe in the urethra, means involving all these urinary system, starting from the kidneys, ureter, then this urinary bladder, then the urethra. Anywhere in any this location, a part of this urinary system, if such type of this stony hard substances, what we call this renal calculi, so that is known as urolithasis. Okay, and it may be due to the bacterial infections, due to some metabolic defect, or vitamin A deficiency, hyperparathyroidism, or as in case of these mineral imbalances also. And if you see the affected kidneys or the urinary system where there used to be formation of these stony hard substances, what we call this renal calculi or urolith. Okay, so mostly those kidneys and the different parts of this urinary system may show different gross lesions. There may be nephrosis, hydronephrosis, and urinary these ureters used to be distended when somewhere this in the distal part of the this ureter, and suppose there is presence of this renal calculi. Okay, this is stony hard substance blocking the ureter. So the urine which is formed inside the kidneys and going out through the ureter to the bladder, it may be retained, it may be blocked. Obstruction will be there. That's why there will be distension of the ureter in that case. Or not only this distension of the ureter, means when this obstruction is there in the ureter, then of course you will have this kind of distension of the ureter, dilatation of this. Okay, and hydronephrosis is particularly means in the renal pelvis and the starting point and connecting and starting point of this ureter when it used to be much dilated, as we have already discussed last time in the last class regarding hydronephrosis. Okay, this way it is coming down that, for example, when the renal calculi is present there at the point where this urethra starts from this urinary bladder. So the urine which used to be you empty through this urethra, it should be going out through the urethra, and it will be blocked. There will be obstruction there. So that's why it may lead to distension of the urinary bladder. More urine will be accumulated there. It cannot be passed out through the urethra because blockage and this obstruction is there due to the presence of this renal calculi. So in that case, distension of the bladder, urinary bladder will be there. And in all cases, mostly, the kidneys used to be much enlarged and hard, and presence of this renal calculi or the stony hard substances, this may be found sometimes in the kidney, or maybe in the ureter, or maybe in this bladder, or even in the urethra. Means according to the location, it may be different, the way different parts of the urinary system it may be located, right? And the various type of this calculi, renal calculi, which differ in size, shape, and composition according to the different this composition of this renal calculi. These are some of the photographs, of course. showing this renal calculi in the urinary bladder here, like, and this endoscopy picture and all, and this in case of the microscopic picture of this renal calculi observed under the microscope. And these are the different types. There are some just different according to the composition of this renal calculi. And also the first one, oxalate calculi, then uric acid calculi, phosphate calculi, then gentin calculi, cystine calculi. Okay, so this way there may be different kind. And their structures are also different. Suppose in case of this oxalate calculi, they are mostly hard, light yellow, and it may be covered with very sharp spines. Okay, so because of this, such kind of this, this may cause, hemorrhagic lesions in the urinary system, like maybe in the urinary bladder, for example. Okay, because of this presence of this sharp spines covering on the surface of those renal, this calculi that. And it used to be very hard and soft, right? Then, so far in case of this uric acid calculi, mostly composed of ammonium or the sodium nitrates, and mostly it used to form acidic type of this urine. And they are mostly spherical and irregular in shapes, and they are not opaque, means by X-ray and all this thing, it cannot be easily detected. Okay, then phosphate calculi, which used to give white or gray colors, chalky in consistency, soft and friable. That's why it means it can be crossed very easily with mild pressure. Okay, and mostly they may be present in multiples in the form of chain-like granules when you were in a urinary system. So it used to be in multiple in the form of some granular chain like these granules. Okay, and it may be composed of magnesium ammonium phosphates, and it mainly occurs as a result of bacterial infections. So these are some of the photographs of the different type of this renal calculi in different locations of the urinary system, right? Schematic diagram also, and this microscope here. And so far the gentin calculi, they are brownish red in color, and they are concentrically laminated, fragile and irregular in shape. And so far, this type of this calculi is concerned, so it is not that common as these animals as compared to humans. Okay, and cystine calculi, usually they are very much small, soft with shiny and greasy in appearance, maybe yellow in color, and they becomes darker when they are exposed to air. And it may be insoluble amino acid cystine precipitates in the bladder to form such type of this calculi. And it may cause obstruction of the urethra with cystinuria, presence of this cystine, this in the urine. Okay. Then next is the inflammation of the, we have talked about the inflammation of the kidneys. Next part is the ureters. So when the ureters are inflamed, then it is known as ureteritis. Okay, so automatically means any organ and tissue which is this inflamed or which gets inflamed, that means the organ used to get enlarged. So here also there will be enlargement of these ureters. The walls may be thickened due to accumulation of uretes or calculi, or pyelonephritis, nephrosis, as well as pyelonephritis may also be present. Okay, and mostly when we are talking about the etiological agents or the factors due to tuberculosis, calculi, renal calculi, hydronephrosis, pyelonephritis, and pyelonephrosis may be the causative factor or agents for this type of this ureteritis. Then grossly, mostly, there may be presence of, deposits which are whitish or yellowish in color. These are the, this mostly the urate in the ureter when we are talking about the avian species like this poultry. Okay, deposition of these things may be there in this ureter. Okay, and there will be automatically this obstruction of the ureter when there is presence of this renal calculi, leading to enlargement and the formation of diverticulum. Okay, somewhere in the ureter, for example, there is an obstruction due to the presence of renal calculi. So just above that, this obstruction site, so there will be this enlargement and distension of the wall of the this ureter. So that used to give little bit back like this structure. Okay, so that's why that condition, what we call this diverticulum. So this usually happens when there is presence of some renal calculi in the on this ureter. Okay. Then next is cystitis. That means inflammation of the urinary bladder. So that is known as cystitis. When you see this urinary bladder, okay, of any species, then you'll find that the urinary bladder is getting this inflamed. Okay, different type of reaction where there may be simply congestion, or some fibrinous type also may be there, or some purulent type also may be there, or this hemorrhagic, these lesions may also be there, depending upon the different etiological agents, maybe like urinary calculi present, then tuberculosis infection and this disease, this mycobacterium infection. Then when there is blockage in the urethra, or Bracken-Fern poisoning. And this I will discuss little bit in details after this. Okay, so that means when this poisoning cases, of course, this is very common in sub-Himalayan region. Last time also I have mentioned, this poisoning and these cases are due to the Bracken-Fern. Okay, for the severe hemorrhagic lesions there, and because of the urinary bladder actually. Okay. That's why these animals used to show, particularly this bovine species. Okay, and they used to show this severe hematuria, presence of this all blood in the urine, what we call this hematuria. Okay, so grossly you should see that the urinary bladder may show congestion, sometimes hemorrhagic lesions, and they are enlarged, distended, or this swelling. Then there may be presence of lesions on the wall, or sometimes the wall of the urinary bladder may also be thickened. So based on the different etiological agents or these etiological factors, the changes may also vary. Okay, and microscopically, of course, there may be those vessels supplying the blood here in this urinary bladder, they may be congested, may show some hemorrhages, and thickening of the wall may be due to the inflammatory this reaction by the presence of those inflammatory cells like neutrophils or macrophages. So far, this this mycobacterium tuberculosis infection, as in case of this TB tuberculosis is concerned, as we have already learned about the chronic and this inflammatory reaction, what we call granuloma and granulomatous inflammatory reaction, where granuloma formation is a must, right? Then in some cases, there may be fibrous connective tissue proliferation leading to fibrosis, and there may be even presence of neoplasms, right? Cancerous growth. So lastly, here is about the, this very important, this is, as I was talking about the Bracken-Fern, this toxicity. Okay, so that very particular disease, which is very common in the sub-Himalayan regions, in the foothills of the, this Himalayan regions, like, this Darjeeling, Uti, Kodaikanal, Karnal, Kumaon, and all. So these are the main, this this Himalayan regions, or anywhere, means in the foothills, particularly, and the Himalayan regions, sub-Himalayan regions, and all. So this fern, what this Bracken-Fern, this is very commonly they are present there. Okay, so this is highly toxic, and they used to contain a toxic factor. Okay, this known as tracheolycite, and this presence of this toxic, this principle, which is thymidines in nature, and when the animals accidentally, of course, this intentionally, they don't take such type of this and this toxic plants, and accidentally they may consume it. And whenever they consume these things, the animal may show the signs of the symptoms of this disease, where particularly there is to be severe hemorrhagic lesions there in the this urinary bladder. That is the main and this pathogenic effect, and this they used to cause hemorrhagic lesions. Maybe this pinpoint or sometimes little bit ecchymotic type of hemorrhagic lesions. And the mucosa used to be very much thickened, and some red cauliflower like these tumor masses may also be formed on the this urinary bladder wall. Okay, so this way the urinary bladder used to show severe hemorrhagic lesions. Because of that, blood used to be oozing out, blood used to be coming out, and that will be excreted along with the urine, leading to severe hematuria, right? And this very particular disease is known as bovine angiotic hematuria or chronic bovine hematuria. Okay, due to this recurrent toxicity. And these animals, mostly, they used to show the symptoms of, this hematuria. That is the main, this clinical feature. Means whenever they used to pass urine, the urine used to be very much bright red in color due to the presence of this all blood. Mostly in the last few drops of the urine, this presence of the blood used to be very much highly indicated. And in the later stages, in the early stages, of course, in the last few blood drops of the urine used to show the presence. But in the later stages of the disease condition, so pure blood may be passed out along with the urine. This means all blood and this pure blood may be coming out, and it may be mixed up with the urine, and that will give very much bright red in color, and that what we call normally this hematuria, right? And these animals, because of the losing of the many and this huge amount or quantity of this blood and all, so they used to get very much weak and emaciating, this condition emaciated, and finally died due to hypovolumetric shock. Okay, and because of this toxic effect also, right? And this gross lesions, as I have already mentioned you that there used to be pinpoint or ecchymotic hemorrhage lesions on the bladder mucosa, or sometimes the mucosa used to be very much thickened and may show presence of some tumor-like clots, and used to take red cauliflower like these tumor masses on the bladder walls. And microscopically, if you see this section, make section and see under the microscope all these affected kidneys and all, then you may find petechial or ecchymotic hemorrhagic lesions, and there may be hyperplastic proliferation of the epithelium, and there may be metaplastic changes to squamous or this columnar epithelium of the these urinary bladder epithelial cells. Okay, and the next is this urethra, this last part of the urinary system, what we call this urethra. Okay, so if it is inflamed, then it is known as urethritis. That means inflammation of the urethra, urethritis. Okay, so it may be, one of the very common, this condition when this animal is suffering from calculi or the renal calculi. Sometimes, some these clinicians use catheters, okay, to detect, or by inserting this catheter in the urethra and all this thing to detect the calculi and all this, right? So the use of this catheter may cause traumatic injury in the renal and this your urethra, or the presence of this calculi itself when it is lost in the lumen of this urethra, urethral opening and this passage, then it may also cause some injury or inflammatory reaction, causing inflammatory reaction to this urethra. So that what we call this urethritis. So that urethra may be, highly congested. Automatically there will be obstruction, and because of that, these kidneys, the renal pelvis may be highly distended and accumulating more quantity of this water, what we call hydronephrosis. And then sometimes even these structures of this urethra also may be there, right? So the etiological factors or these agents causes are like presence of this renal calculi, the traumatic injury caused by catheter, using of this catheter, sometimes the infections like trichomonas fetus, okay, then picornavirus infections and all. And if you see this affected, this part of this urethra grossly, then There may be inflammatory reaction, what we call transient type of this inflammatory reaction, and highly congested this because of this urethra. And then sometimes some hemorrhagic lesions and presence of this renal calculi within this passage, urethral and this passage may be there. If it is a case of this, renal calculi, so it will, or it may lead to obstruction of this passage, urethral passage, or according to the this female and this male, sometimes because of this inflammatory and all. In case of these males, so strictures used to be very common. This constriction of the this urethra and all. Whereas in case of this female, so diverticulum is very common of the urethra. Okay. So this way, these are some of the these pictures I'm just showing about the this this infarction, as we have already learned. Ischemic necrosis. In general pathology, and this in the name of this infarction also, what is infarction and all this thing we have already discussed in the general pathology, right? So those infarct lesions in the kidney, if it is used to be there, and it used to give little bit this triangular cone shaped. So these are the these infarct lesions of the renal cortex, okay, in these kidneys. So renal infarcts, they used to be, lesion used to be looking like this. Then these are some schematic diagram. So this is all about the pathological changes or pathology about the urinary system. Okay. So in the next class, I will take up another system, reproductive system. Okay. So I will provide you the this PDF format of this all these systems later. Okay. And for this urinary system, I will be giving you today. Okay. That's all for today.
Thank you, sir.
Thank you.